Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 033. A 40-year-old man with Bekhterev disease, ankylosing spondylitis, complains of elevated body temperature up to 37.8 degrees C, back pain and stiffness, especially observed during the second half of the night. This condition has been lasting for 2 years. Objectively. Reduced spinal mobility, painful sacroiliac joint, erythrocyte sedimentation rate 45 mm per hour. X-ray shows narrowing of the intervertebral disc space and of the sacroiliac joint. What eye pathology is often associated with this type of disease progression? A. Optic nerve atrophy. B. Iridocyclitis. C. Retinal detachment. D. Cataract. E. Blepharitis. Types of back pain: mechanical, from overuse injuries, poor posture, or a herniated disc. Inflammatory, from a problem with the immune system attacking the joints of the vertebrae. Sacroiliac joints and the entheses. Erythrocyte sedimentation rate, ESR, is a type of blood test that measures how quickly erythrocytes settle at the bottom of a test tube that contains a blood sample. The normal range of ESR is 0 to 22 mm per hour for men and 0 to 29 mm per hour for women. The high value of ESR may be related to an inflammatory condition such as infection, rheumatoid arthritis, rheumatic fever, vascular disease, inflammatory bowel disease, etc. Back pain that wakes an individual up in the second half of the night is one of a few key signs that it could be inflammatory and due to a disease like ankylosing spondylitis. Ankylosing spondylitis is an inflammatory disease that, over time, can cause some of the vertebrae to fuse, making it less flexible, possibly resulting in a hunched posture. The inflammation may also occur in other areas of the body. If it occurs in the eye, uveitis, iritis, etc. Iridocyclitis is an acute inflammation of the iris and ciliary body, the most common pattern of uveitis. If ribs are affected, it can be difficult to breathe deeply. The symptoms usually develop slowly over several months or years. It usually first starts to develop between 20 to 30 years of age. The answer is B. Iridocyclitis.